This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Democrats may hold Connecticut's governor's office and have the majority in Connecticut's General Assembly, but Republicans also have ideas on how to run state government. Today, Where We Live, we talk with Republican State Senator Kevin Kelly. He's been a state legislator since 2011 and represents the towns of Monroe, Seymour, Shelton, and Stratford. He's the new Senate Republican leader, succeeding Len Fasano, who retired from the General Assembly last year. What questions do you have for Senator Kelly? You can join us, 888-720-9677. That's 888-720-WNPR, or you can find us on Facebook and Twitter at Where We Live. Coming up, we'll hear from Associated Press reporter Susan Haig, who's a longtime state capitol reporter. That conversation later. But first, I want to welcome to the show on Zoom today, State Senator Kevin Kelly. Senator Kelly, welcome to the show. Senator Kelly, can you hear me?
Yes. Good morning, Lucy. It's great to be here.
Thank you. And thank you. We love Zoom. We appreciate your flexibility this morning. So when we had scheduled you to come on the show, I was gearing up just to talk about the governor's 2-year state budget. But we have to start talking about the Marathon Public Health Committee hearing that I believe just wrapped up just moments ago. Again, this was an online public hearing on bills that would end the religious exemption to school vaccine requirements. And this is an exemption that has been used by some parents who think that vaccines are dangerous and say it's their religious right to deny the vaccines to their children. And so I'm wondering if you could talk a little bit about your reaction to this hearing. And does the length of this hearing say something about the nature of this debate? It's not the first time it's been before legislators.
Well, Lucy, this is a big issue, and the process is as important as is the issue. The process is part of this virtual reality that the majority seeks to handle legislative business this session. And while we agree that it's important to get the people's voice back in the building, because we, for the past, 11 months now, the governor, one person, has been in charge, and our government's not built that way. It's built to have all voices at the table. So it was good that we opened the General Assembly on January 6th and that we got the people's voice back into the process. The problem that I see is that by doing this virtually, we know, and the governor started to address this with his broadband initiative in his budget, we know that 23% of Connecticut is without connectivity to the internet. And most of those are people who are poor and people who live in our cities. And that, I'm going to say, disenfranchises a substantial part of Connecticut. And so we really should be focused on issues that are germane to handling the pandemic, which I think is the single biggest issue that all families in Connecticut face. But when you see initiatives like they're dealing with in this public hearing, where they've had almost 2,000 people line up to speak, and the majority, the chairman of the committee, shuts the debate down after only a couple hundred people speak, that's chilling, because you've left off 1,800 voices. And then there's another petition of, I think, like 15,000 people who want to be involved in the conversation. And when we don't have all voices at the table, I think it doesn't make for good policy. And that's the problem here, is that it appears that the majority has made up its mind. It really doesn't want to hear the people and move forward with what they believe in. And the thing that's most, I'm going to say, discouraging to me is that it's happening in Hartford, in that city, the city where the government of the people, by the people, and for the people was born.
Senator Kelly,
Constitutional government is Connecticut's heritage. It's our tradition.
Well, this is an issue that's come up before, Senator Kelly, though. This is an issue that's come up several times. People have come out to the Capitol and have testified, but people can also submit written testimony. And so you really believe, because this hearing was only allowed for 24 hours, that people aren't able to get their voices heard, that legislators aren't able to understand both sides of the issue?
Well, I think well, first of all, it's the people's government. It's not our government. And so the people have the right to their voice in government. And not everyone wants to participate either verbally or in writing. Some people don't want their names to be associated. They want to be counted. And this is where I think whenever you go to many hearings in Hartford and you see issues, people will actually wear a colored T-shirt to support. If it's AARP, it's red. If it's 1199, it's purple. And it's a way for people to congregate and have a community voice that is not only visible, it's palpable. And where is that voice in a virtual world? It doesn't exist. And I think we lose something in the process when we, I'm going to say, suppress that speech.
And so this, again, has to be voted out of this particular committee before these bills are before the full legislature. Do you see that being an expected reality with the Democratic majority in the legislature, Senator Kelly?
Well, usually the committee is where we do the work. That's where you get all the voices. I mean, many have described legislative process as a sausage factory. Well, this is where the sausage is made, in the committee. It's where you put an issue out and then you draw all conversation from every viewpoint and try to get as much input as possible and viewpoint. And it's going through that crucible of differing opinions that we end up with better policy. And I think that's why, if there's this many voices that want to be heard, we need to hear it before it comes out of committee. And then once it gets to the committee, we'll have a conversation amongst legislators. It doesn't end at the committee, but certainly that is where most of the work is done.
Has this become a partisan issue, this bill to get rid of religious exemptions for school vaccine requirements? And where do you stand on this particular bill?
Well, we've had it a few times when I was on children's. This bill had come up a few times in committee for different reasons. At that point, they were trying to, the proponents of the bill were trying to do away with school nurses taking an acknowledgement and require anyone seeking a religious exemption to be forced to disclose their medical history and records to a non-compliant HIPAA official. And so that was patently unfair. And once again, this issue is really centered on, our religious freedoms, whatever they are. Our government must be one of tolerance. And we must stay focused and adhere to that tradition, as well as patient-centered care. And I think that's one thing here is that, this is a departure, in a sense, from the traditional Democrat position of my body, my choice, but not here. They're not focused on the patient-centered choices. And then just the whole perspective that they're not listening to the people's voice. And it's apparent that they would prefer your vote, but not your voice. And when you look at that, I think this is problematic for this bill. It's very controversial at this time to do it in this manner. But right now, the way I see the bill, I would be against the bill.
You mentioned religious freedoms. Is that what this is about when people say that it's their religious freedom to deny these vaccines for their children? When we look at the data that's been collected, the number of Connecticut schools where less than 95% of kindergarten students from 2017 through 2019 were vaccinated against measles and mumps and rubella, that's increased by 31%. The ones that were not vaccinated because of religious exemptions. Is it more about personal choice and parental choice than religious freedoms, Senator Kelly?
Well, I think what we need to do is to allow individuals here in America. Once again, these are very strong, time-honored tradition that we need to be tolerant of everyone's religious choices. Included in that are folks with no religion. There is that aspect of this too. But what we need to focus on is to enable individuals with religion to exercise that religious belief freely. Now, a lot of what goes on here is compliance issues. Maybe there are children that are not vaccinated. And so we need to focus on that and maybe make sure that individuals who have fallen behind on vaccines or vaccinations need to do so. And there needs to be a more, I'm going to say, reasoned and common sense approach to this. And then look at the science and the metrics. I mean, what is the number of actual individuals as a percentage of students that are not vaccinated, and what does that threat mean? I guess those are the issues that we need to focus on.
I think that's part of the bill, compelling the Department of Public Health to have that data, more consistent data each year. But the fact that we're in a pandemic, Senator Kelly, when we think about, again, when we look through history, when polio caused a lot of fear in people and Americans lined up to get that vaccine. Back then, they didn't have social media to help spread a lot of this misinformation about vaccine science. And so do you worry about the message that this sends when we have seen measles outbreaks in New York State just a couple of years ago?
Right, but I'm not disputing that those exist, but to narrowly focus it on school children as the culprits of all measles outbreaks. And, when we hear testimony last night, I heard a lot of people testifying that some individuals had this, they caught these viruses in hospitals. So it's not just limited to school-age children. There are other members of the population that also have this issue. And so once again, it's an issue that I think needs to be looked at, but we need to, once again, be mindful of how strong, it is the First Amendment of all constitutional amendments, is the right to religious freedom, as well as to petition your government. And both these issues, the way it's being handled by the majority, is to cut off debate, and it abridges a religious freedom.
You're hearing State Senator Kevin Kelly here on Where We Live. He's the Republican minority leader from the 21st Senatorial District. You can join our conversation, 888-720-9677, or find us on Facebook and Twitter at Where We Live. I wanted to move on because I know healthcare is something that you are deeply involved in. When we think about this upcoming budget and ways to make healthcare more affordable, especially in this pandemic, I'm looking at a proposal in Governor Lamont's two-year budget plan that includes a new fee or tax on health insurance companies that could bring in about $50 million, with the money intended to be used as subsidies to help more people afford health insurance on the health exchange. And we know that tens of thousands of Connecticut residents have either lost their jobs or had to take pay cuts in the pandemic. What do you think about this particular proposal?
Well, let's back up. I think we all agree and recognize that Connecticut middle-class families did not get the promise that was made to them 8 years ago by the Democrat majority of affordable health care. The Affordable Care Act promise was that health care would become affordable, accessible, and of high quality. And that promise has never been delivered. Now, one of the big reasons is that the federal funding of it dried up. So we have a bill that is to impose or to create a state reinsurance program that would provide that level of funding. We do it, however, just out of a general fund appropriation rather than what the governor and the majority are looking to do, which is to add a tax. And what our plan does is it provides the same premium relief of up to 20% as the public option. But where we differ is that we actually go to the actual cost drivers, which are medical costs. And we tear a page out of Governor Charlie Baker in Massachusetts' book by using benchmarking. And in the Commonwealth, he has been able to reduce the rate of growth from 10 to 12% down to 3.5%, saving billions of dollars for the state of Massachusetts. And we make sure that all of the Affordable Care Act protections are embedded in the reinsurance program, and we keep the good paying Connecticut insurance jobs. What the public option does is we'll actually have the state of Connecticut go into direct competition. And that direct competition is going to kill Connecticut jobs. So it doesn't get its arms around the cost driver, it kills Connecticut jobs, and it's backed by the taxpayer. And so that's problematic. This whole concept that's in the governor's budget of the tax on health insurance premiums, we're trying to lower premium. A tax on premiums just increases their cost. And there's the $50 million that you referenced that looks at premium relief, but there's also a component there that talks about, I'm going to use it loosely because it's not really Medicaid rules, but they use that language in the bill, another $25 million. So that's a $75 million tax increase on health insurance when health insurance is already breaking the middle class families back. And we think that that's not the smart policy choice. We think our way, leveraging federal money, using a reinsurance program is the better option. And quite frankly, the exchange has commissioned a report done by the Wakely group, and that came back and said that our reinsurance program is the most effective way to leverage federal money and bring relief to Connecticut families.
So you don't support. So you don't support the public option, but the reinsurance proposal is something that you want the legislature and the governor to take a look at. Again, it would set aside funds from the state budget so that insurance companies could tap if claims in a certain year exceeded a certain amount. Senator Kelly?
Yes, and the governor is interested, and I will say, we did before the pandemic came. He did issue an executive order to start the benchmarking. He pulled that concept out of our bill, and has also indicated that he would support the reinsurance program that we're proposing over the public option. So there is hope on this, because I do believe that this will bring the most benefit to middle class families and help them pay their health care costs.
Last question before we take a break, Senator Kelly. So how would you ensure through reinsurance that these savings would then be passed on to customers?
Well, what happens is that the reinsurance is there to make sure that premium relief is provided to the families, the people who are purchasing insurance. That's number one. The second is this benchmarking. If we can drive the cost of healthcare down, not only is it going to reduce the cost that insurance companies are paying for these services, but it's also going to affect the state budget, because the state budget has the current state employees, the state employee pension fund, as well as the Medicaid program. So if we could save, 5, 6, 7% across those line items, and then reinvest those funds back into healthcare and reinsurance, we could continue to drive the cost of premiums down. And that's why we think this is the smarter way to go, because it actually has that cost, the saver part of it that's going to drive the actual cost of healthcare down. And by reinvesting that money, it's going to bring more relief to Connecticut families. Mm-hmm.
You're hearing Senator Kevin Kelly. He's the Senate Republican Minority Leader in the Connecticut General Assembly here on Where We Live. You can join our conversation, 888-720-9677, or find us on Facebook and Twitter at Where We Live. We'll be back after a short break. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. With us today is Senator Kevin Kelly. He's the Republican state minority leader in our Connecticut General Assembly. You can join our conversation as we talk to him about the Connecticut budget. Again, Governor Ned Lamont releasing his 2-year plan just the other week, as well as other issues in our state. 888-720-9677, or find us on Facebook and Twitter at Where We Live. We know that vaccinations for COVID continue in our state. Senator Kelly, now people 65 and older can get it. We saw the governor getting his shot just the other day. But there has also been reports about how there are widespread disparities in the vaccinations of our residents in our state, including the Connecticut Mirror finding that white residents over the age of 75 are more than twice as likely to have been vaccinated than black people in the same age group, and white seniors more likely than Hispanic seniors to have been vaccinated. Are you concerned about these disparities in our state related to the COVID-19 vaccine, and what could be a role for the General Assembly to respond to this, if at all?
Yes, Lucy, I'm very concerned about it, not only here with regards to COVID-19, but in fact, health disparities overall. Last session, last spring, even before COVID hit, we put in a bill to study this. And I was disappointed that the majority during special session in both July and September didn't bring up this issue so that we could start the process, which is to start to collect the data, to start to do the research, the due diligence, to find out what is at the heart of this issue. Because nobody should have or be without health care. And everybody is entitled to the same accessible and quality health care. And so the legislature definitely has a role here. The legislature needs to study this. And in my mind, in July, when we had special session, there's no time like the present. We could have started it in July. We could have started collecting the data, looking at what is going on, and making sure that these disparities are addressed and alleviated.
And so moving forward, now that there is a regular session, I'm just wondering if you could talk a little bit about, how lawmakers, policymakers should continue to respond to this pandemic to make sure that people who choose to be vaccinated against COVID-19 are able to get those doses.
Well, exactly. I mean, first of all, this whole health equity is also part of our reinsurance bill. We did bring it into that as our health care bill. But looking at just how this rollout has occurred, I mean, there are, I'm going to say husbands and wives that, or spouses that want to get the COVID vaccine and can't do an appointment at the same time because of the way the system was set up. And these are the conversations that I think we should be having more of, and having the governor's ear to be able to bring these experiences to the table and see what we can do to rectify them so that people can handle this pandemic. And I mean, the COVID vaccine is one, mental health is another, social isolation. There's a whole host of issues that actually have very poor health outcomes. And they just aren't being addressed, quite frankly, because I don't think there's enough voices at the table.
And so that would be in reference to Governor Lamont extending his COVID-19 emergency authority through April 20th, Senator Kelly?
Well, it's not only there, but it's also born on the, coming off the experience we all saw what happened in skilled nursing facilities where, when the Mathematica report came out, 74%, this was in, I'm going to say September, up until that point, 74% of all COVID-related deaths occurred. So when the General Assembly put together a task force to start to study the impact of COVID on nursing homes, they included basically every stakeholder except the seniors, people and patients who were affected by COVID. And so the aging committee, of which I'm ranking member, was prohibited from participating in that task force. And I think that's the voice that needs to be heard. And once again, getting back to what we talked about earlier, there seems to be a departure by the majority from patient-centered care, that there should be a patient-centered focus. And here, when we look at how COVID is affecting all of us, we really should be looking at it from the eyes and ears of the people who are affected. And that could be directly folks in nursing homes. It could be people suffering from social isolation in their own homes and the mental health consequences. Or it could be as simple as, spouses want to go to get the vaccine, and why can't they make an appointment together? And that voice needs to resonate more under that dome, and unfortunately, it hasn't been.
Mm. Again, this emergency powers through Governor Lamont through April 20th. We just heard from the governor the other day. Again, the numbers are looking better. The restrictions on caterers and restaurants to hold bigger indoor and outdoor events have been lifted, and the numbers have grown for the number of people that can attend those events. So do you think that we're going to be out of this by April 20th, Senator Kelly?
Well, I'm not sure we're going to be totally out of this by April 20th. Clearly, the metrics are looking encouraging, and I'd like to make sure that we continue on that path. But we also need to be mindful and guided by the science and technology here that there are variants that might be more infectious, and so we need to have a balanced approach. But even with that balanced approach, our government is not wired for just one person to be in charge. And I believe there are ways to manage this pandemic where we would have more of a collaborative approach and get the people's voice at the table along with the governor's voice. I think that's the way our government is structured, with three separate, equal branches of government. And right now we've only had one branch really operating at full tilt. You've got the judiciary, which is also open. But as far as managing the pandemic, the people's voice has not been as robust as it needs to be at the table.
You're hearing State Senator Kevin Kelly here on Where We Live. He's the Senate Republican Minority Leader from the 21st District. You can join us if you have a question for him, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Again, you were elected back in 2011 to the Connecticut General Assembly. Do you feel that Republicans in the state will have a better working relationship with Governor Lamont this session in terms of being invited into these conversations, Senator Kelly?
Well, I always think that good ideas, find friends. It's why I think, and we've been pushing more than, it's not just this session. I've been pushing reinsurance for a number of years, even before Governor Lamont, because it's a good idea. I think it's an idea that resonates because it brings relief to middle-class families. It reduces healthcare costs and saves jobs. We're dead last in the nation in job growth and personal income growth. And I think it has a lot to do with the policies that the majority has passed over the past decade that have actually, negatively impacted Connecticut families. And so I look forward to raising good ideas. I think they do attract friends. I think in the area of healthcare, we can find a way through this. And I think we're proposing ideas that are the better way, because they not only bring relief to the middle class family, but they keep jobs, and I think they make Connecticut more affordable. That's the one thing I hear from families and voters, is that Connecticut's just too expensive. It's unaffordable. Well, when you're adding $75 million onto healthcare premiums, it's not going to get cheaper. And so if you listen to the people and bring their ideas to the table, I think they'll resonate. And that's why I'm very hopeful, not only for this session, but for our party moving forward.
You're one of the highest ranking state Republicans in our state now. And we got a message on Facebook. Someone writes, I'm curious what plans the Connecticut GOP has to encourage former Republicans like myself to rejoin the party, especially after the last 4 years. How do you respond to that? And we've seen headlines, not only in our state, but around the country, of more Republicans leaving the party. Senator Kelly.
Yes. Well, I think, first is that Connecticut Republicans have always been different from national Republicans. And I think if you focus on what Connecticut Republicans have been doing, for like the initiative on reinsurance is a good example. We had another proposal to invest in transportation without tolls and taxes. And so what we look at is bringing relief to middle class families who find Connecticut unaffordable, and to look at what they need from their government, like reduced and affordable, quality and accessible health care, and ability to get to and from work without adding extra financial burdens, whether it's a gas tax or a toll. So what we're doing is coming up with very creative solutions to solve Connecticut families' problems, but not doing it that either kill jobs or make Connecticut more unaffordable. And I think if people, not only Republicans and Republicans who are thinking about leaving the party, but also unaffiliates, and what I'm going to say is my mom's Democrats, if they start to see what Connecticut Republicans are doing and we focus on Connecticut issues, I think they'll see that we're listening to the middle class, and that we're proposing ideas to get results for those families.
You mentioned a gas tax, so I assume you're referring to the TCI, this Transportation Climate Initiative, the Cap and Invest program, looking to lower greenhouse gas emissions, but also using money from, the payment to large suppliers of transportation fuels, what they're paying to at a wholesale level, included in the price of fuel, being passed on to consumers. But what about the investments in public transportation, a more robust system around our state to help all residents, including the middle class? Isn't that one of the benefits that could help our residents in our state?
Well, it is a benefit that would help residents in our state. And our program, FASTER, FAST RCT, that we proposed would make those investments, not only in roads and bridges, but in I'm going to say our rails and public transportation. The thing about this TCI, the Transportation Climate Initiative, is a 17-cent gas tax that's paid to a regional authority. And it's really aimed at not only these measures of public transportation, which are important, but they're being done here in the context of trying to reduce our greenhouse emissions. And the issue becomes that Connecticut can do that. In other initiatives, we can do it with both, alleviating congestion on 95, 91, as well as, just other open space initiatives. The interesting thing here, Lucy, though, is that, one of the reasons for the TCI is clean air. And most weather patterns run east-west. So our air comes from New York, New Jersey, Pennsylvania, Ohio, and not from north-south, which is what this TCI regional approach does. So what our contribution and sacrifice will benefit, Rhode Island and the Atlantic Ocean. And while that's very worthy, unless we get some help from the federal government to get New York, New Jersey, and these states to our west to do likewise, we're not going to enjoy the benefits from an environmental and a clean air perspective. So, we're looking to our Washington delegation to work with Washington and to see what can be done to make sure that aspect of the TCI occurs so that our Connecticut residents can get the clean air they deserve.
Kathy tweeted what she wants to hear from you about, do you believe the governor's budget proposal meets the needs of people who rely on state-funded services? And also, do you agree with the governor's proposal to use asset tests for Medicare savings programs?
No and no. Medicare savings program, I'm really disturbed by this because right now there is no asset test. But I believe what they want to do is put in an asset test. And once they put asset tests in, the way the Department of Social Services operates is that they will use that as a way to, I'm going to say, put an impediment in front of people to get the benefits that they need. And and I firmly subscribe that assistance delayed, particularly when it comes to Medicaid and human services, that assistance delayed is assistance denied. And that's just a mechanism to make it more difficult for people to qualify at a time when we need more people to get preventative health care. And that's what that Medicare savings program would do, is give them the tools to prevent further, I'm going to say, poor health outcomes. So I think that's a poor policy choice and not smart. As far as the budget itself, I think we don't do enough in human services. I don't think we partner with our private nonprofits who can do more with less and more quality services at a time when we have the people in need, more demand and less resources. We need to be creative and be able to deliver these human services. And so I think the governor falls short on both issues.
You can join our conversation again with State Senator Kevin Kelly. Jay's calling in from Trumbull. Jay, go ahead.
Oh, hi. Good morning. How are you?
Doing well.
Thanks for taking my call. I appreciate this opportunity to ask the senator as quickly as possible. All due respect, sir, I would just like your opinion if it has ever occurred to you that part of our problem with healthcare is at root the for-profit incentive and intellectual property rights, patent rights. Do you think this affects our issues in dealing with the distribution of the vaccines right now?
That's an interesting question. I mean, obviously, one of the things is that the current system we have has enabled us to have significant and important, I'm going to say, health advancements. We did end up having a COVID vaccine a lot quicker than many people thought. And I think that's because of the cutting edge technology, the cutting edge aptitude, the knowledge and skill that we have in this area. The profit isn't always a bad thing. And that's where, we look at, many folks are looking at, I'm going to say just normal capitalism as being evil, but it is what has made America great. And there are certain areas where you have market failure. And when there is market failure, I think there's a role for government. But that doesn't mean that there's always market failure. And so we need to be mindful of that and just keep that in focus as you move forward, is that there are a lot of benefits that capitalism brings: good paying jobs, a healthy economy, a standard of living that we all enjoy. But there is also times where there are failures, and that's where, when the market can't deal with that, government must.
I want to thank again Senator Kevin Kelly. He's the state Senate Republican minority leader in the Connecticut General Assembly. We appreciate your time coming on the show today.
Thank you very much. It's a pleasure to be here.
This is Where We Live on Connecticut Public Radio. Coming up after the break, we're going to get some more context about the issues before lawmakers from longtime Connecticut Capitol reporter Susan Haig. She's with the Associated Press here in Connecticut. You can join us too. Find us on Facebook and Twitter at Where We Live.
Support comes from the Narrative Project, Connecticut's only anti-racist and social justice public relations agency, helping organizations through socially responsible communications consulting and management. narrative-project.com.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up Thursday, broadband internet and phone service have become essential during the pandemic. Tomorrow we talk with Federal Communication Commission Acting Chairwoman Jessica Rosen-Worsel. She's also a West Hartford native. We'll talk about the FCC's role in making sure Americans have access to connectivity during and after the pandemic. Now, has your family struggled to access or even afford high-speed broadband internet? You can join us. That conversation tomorrow. Now, you just heard State Senator Kevin Kelly here on Where We Live. He's the new Senate Republican Minority Leader in the Connecticut General Assembly. I wanted to welcome onto the show now Susan Haig. She's Associated Press State House and political reporter here in Connecticut. Hi, Sue.
Hey, Lucy, how are you?
I'm doing well. So we started off the conversation talking about this marathon public hearing before the Public Health Committee, looking at this, again, these bills to get rid of the religious exemptions for vaccines. Do you see this issue? Has it become partisan? And what did you think about Senator Kelly's points about this hearing should not have been concluded in just one day?
Well, I wanted to, thanks first of all for having me. He did say there were like a couple of hundred. They got about 420 in, or 400. They're in the 420s as of like 8:45 this morning, which is far from the 1,931 who signed up. So I'm sure there are a lot of disappointed people. This issue, it does tend to be more partisan. There are some Democrats who are with these Republicans who oppose the legislation that would get rid of the religious exemption. Not all Republicans oppose getting rid of it, but it is sort of an issue that more of the conservative caucus has taken up. It's something that's been happening. This bill has been up for the last several years. Mm-hmm. If it's not actually proposed, it's just been discussed. And there seems to be more of a push among the supporters, given the COVID outbreak and the focus on having the importance of vaccination. So, but again, it's hard to tell whether or not there will be enough support this year. It is such a contentious issue. It really is.
Do you think that the pandemic has changed things for lawmakers who have looked at this bill in the past sessions, as you've mentioned? Again, when we think about the importance of vaccines, the COVID vaccine would not be part of this school vaccine requirement list, but I just wanted to clarify that. But, has the debate changed because of the pandemic, Sue?
It kind of came up yesterday. The argument from a lot of the parents say that they would have to keep their kids out of school because they don't want to have their kids vaccinated. And it's not, and some people, they're only upset with maybe one of the vaccines. Some actually have vaccinated their kids and they're against this bill. But I'm sorry, I lost my train of thought.
I was just wondering if the pandemic has changed how lawmakers are thinking about this issue versus previous
sessions.
I'm
sorry. Yes, so what came up is that there's a lot of concern about kids having to learn at home. And they said that the pandemic has really brought out those concerns. And that's one of the reasons why they shouldn't pass this bill. And that's an argument that we haven't heard before.
Moving on, Senator Kelly spent a lot of time talking about the reinsurance proposal. This is in response, it was to my question related to taxing insurance companies, but rolled into that was also his opposition to the public option. So can you walk us through, again, this proposal for the public option and then how reinsurance relates to that?
Well, the Democrats have proposed this bill that small businesses with up to 50 employees and nonprofits and certain unions, they'd be allowed to buy into a variety of healthcare plans that would be offered by the state. So that's per se the public option. Their bill is really wide ranging. I mean, it also includes subsidies for individuals to help pay for their insurance coverage. There would be an expansion of Husky eligibility, the state's health insurance program for mostly kids. So that's their proposal. The governor it's interesting, he has not proposed a per se public option. He's in his budget, he has something called Covered Connecticut, and that would provide premium insurance through an assessment on insurers. So there is. It's unclear, again, what's going to happen by the end of the session because some Democrats are pushing more of a progressive answer to this issue, than the governor is. And then the whole reinsurance thing is something that Lamont has actually spoken positively about. And that would be a way to sort of leverage federal money to try to help insurance companies offset very high costs for certain patients with very expensive medical conditions. The governor has been very interested in trying to leverage as much federal money as possible, and that would be another way to try to tackle this problem in his mind.
I asked Senator Kelly about what kind of relationship he anticipates the governor having with the state Republicans, because the Democratic majority has gotten stronger. I'm just wondering if you can give us some context about what you've seen in this past session with Governor Lamont and what may happen these next few months.
Well, the past session was just so strange. It's hard to compare to any other session. There has been complaints from Republicans and Democrats, I got to add, that the governor has done too much alone. He's gone it alone too much. There does seem to be more concern, though, among the Republican lawmakers, including Senator Kelly, regarding extending the governor's executive authority. There's a thought that it's really now time for the legislature to take over a lot of these issues. The governor has said that he has an open door policy. He says this quite a bit. And he does seem to be willing to, talk to Republicans on some of these issues like reinsurance. There's areas there where potentially there could be, some ways for them to work together. But again, he's still a Democrat. Democrats have a strong majority, and that's who he tends to work with.
Except for the issue of whether the wealthy Connecticut residents should pay more in taxes. That's something that Governor Lamont has drawn a line on. Right.
Well, that's interesting too. There are more since you mentioned I've been at the Capitol a long time. These caucuses have sprung up, and the Progressive Caucus has gotten stronger. And that's an issue that they are really pushing hard on. And also the Senate, leadership is also interested in some of these issues too. And that's where you could see some friction down the road. But there is, some concern among more progressive Democrats that the governor's budget didn't do enough to address equity issues in the state, didn't do enough to help struggling nonprofits. They want to see more money spent. And then even the Republicans are complaining that there wasn't enough money spent to help struggling businesses. So he has some bipartisan opposition that he has to get through in the coming months.
You've been hearing Susan Haig again. She's Associated Press State House and political reporter here in Connecticut. Sue was one of the first people I met when I moved to Connecticut and started covering stories around the state. You've always been so gracious, and you do a great job. We appreciate your context here today on the show.
Thanks for your kind words. Nice to have you.
Today's show was thank you. Today's show was produced by Matt Dwyer. Thanks to Carmen Baskoff, and our technical producer is Kat Pastor. I'm Lucy Nalpathanchel. We'll be back tomorrow.